Warmest greetings to you all. Continuation of my video on natural method of family planning. Previously, we have seen a video on calendar or rhythm method, and today I will continue with the remaining method. But before then, I would like to emphasize that these methods are not reliable, but they are very effective for those who do not practice modern method of contraception, and also effective during emergency situations when the couples are left with no choice. So today I'm starting with basal body temperature method from the name temperature method. So in this method, the woman is expected to measure and record her temperature for about 3 months before even stepping out of the bed, so that she will know the pattern at which her temperature rises and the pattern at which her temperature returns to normal. So before starting this method, the woman should measure and record her temperature in a chart with separate thermometer for about 3 months. So this, while the ideal time to measure this temperature is immediately early in the morning, even before coming out of the bed, so that things like exercise and other activities should not influence the normal body temperature. How to practice in this method? This method is usually started from the first day of menstrual bleeding. The first day when the woman starts experiencing her menstrual bleeding, that is the ideal time that she should start measuring her temperature and record it. So for example, the first day she records 36.1, then continuously she's getting 36.1. Maybe around 10th day she got 36.5 and continuously getting 36.5. Maybe by around 14th day to 17th day. Now by around 17th day, the temperature now returned to 36.1 and continuously up to another cycle. So the period at which the temperature get higher to 36.5 is the ovulation period of that woman, and is the critical period by which pregnancy occurs, which she should avoid intercourse at that period. So the mechanism of this method is that prior to ovulation or during ovulation, there are slightly increase in normal body temperature of the woman because of the influence of hormones such as estrogen, progesterone, and other hormones. So the woman should have her separate thermometer and a chart or a book where she will be recording her temperature every day and be recording it on that book up to another cycle, so that she will abstain from intercourse wherever her temperature gets slightly in increase. So the woman should not expect too much rise in temperature, so she should be very careful. Highestly, the temperature increased by 0.3, 0.4. The highest at which it increased is 0.1. So this may be little tricky, so the woman should not experience or should not expect high rise in body temperature. Of course, I'm just setting example with 36.1. We know we may have difference in individual body size and different location. So there are a lot of things to put in mind while practicing this method, which may affect the normal body temperature of the woman. Example, the commonest is disease condition. We all know our society where we are almost prone to malaria epidemic. So common malaria can affect this method and may render it invalid. Even common stress can affect her normal body temperature, which may be difficult to detect the rise from her ovulation and the rise from other things like stress, the environment, and the rest. Even exercise can affect the normal body temperature. That is why it is advised to start recording the temperature even early in the morning before even coming out of the bed. So this is a basal body temperature method. Now going to the third method, which is cervical mucus or billings method. So usually cervix produce some mucus which help to nourish the vagina. Cervix is located immediately above the vagina and is the lower portion of the uterus. So this mucus is highly influenced by hormones, which influence its texture, its color, and production. So in this method, the woman is targeting a period at which this mucus change in various texture, color, and volume so that she may know her ovulation period and abstain from intercourse at that period. So how this mechanism and how this method is practiced? This method is practiced immediately after menstrual bleeding. Like the temperature method, I said the first day of menstrual bleeding. This one is immediately after menstrual bleeding. Some women, her menstrual phase may stop by 5 days, some by 12 days, so depending on her pattern. So you start, how you do it is that when it is the last day of your menstrual bleeding, you get your fingers clean, then you insert your fingers into the vagina and fetch out some mucus. Then when you fetch out those mucus, then you rub them in between the thumb and the index finger and stretch it and peel the mucus. So initially, immediately after menstrual bleeding, that is around the 8th and the 9th day, is called dry period. Mostly the woman don't see any mucus at that period. As such, that period is called safe period. Pregnancy is unlikely to occur since she cannot find any mucus. But before ovulation, that is around 10 to 12 days, when the woman fetch out those mucus and examine it in between the thumb and the finger, the mucus will look cloudy, whitish or yellowish and sticky. So when the woman stretch the mucus, it will appear in such either of these three colors: whitish, cloudy, yellowish and sticky. Then during the main ovulation period, which is around 12 to 14 days, when she examines the mucus will become very clear and slippery, like raw egg or an okra soup. When she stretch it in between the fingers, it will look very slippery and very clear. Then after ovulation period, that is around 14 to 17 days, the mucus, now after 17 days, the mucus will now return to its cloudy nature. It will look cloudy and sticky. So this is the three patterns of color at which the woman may see when examining those mucus. So during prior to ovulation, when the mucus become yellowish, cloudy and sticky or whitish, that is around 10 to 12 days. That is to say, she is approaching her ovulation period and she needs to abstain from intercourse at that period. Of course, during ovulation, around 12 to 14 days, or 12 to 17 days, when the mucus now look very slippery and clear, that is her main ovulation period, and she needs to abstain from intercourse at that period because it is unsafe and fertilization can occur. And after 17 up to 28 or 30 days, when the mucus now return to cloudy nature and sticky again, this is her safe period. So even if there is intercourse, pregnancy is unlikely to occur. So these two periods, that is immediately after menstrual bleeding, that is the 2 days around 8th and 9th day, and also after 17 days up to 28 or 30th day is the safe period. That is, pregnancy is unlikely to occur. That is when she cannot experience mucus and when the mucus returns to cloudy and sticky in nature. So like I said, in basal body temperature, this method also is subjected to a lot of factors which can affect the color and the texture and even the volume. Example, the commonest sexual transmitted disease. These diseases can affect the cervix, especially you see women with abnormal discharge, which may affect the color. Insertion of medications, of course medication will affect the color. Insertion of lubricant may also affect the texture of the mucus. Vaginal dotting may also affect the surgery around the cervical region, may also affect the production and the texture of the mucus. So while practicing this method, all these things should be put in consideration to avoid chances of failure. I hope you find this video very educative, helpful and interactive. If you have any comments, you kindly drop it any of my social media handle, and don't forget to like and subscribe on my YouTube channel. On the next video, I will round up this natural method of family planning by explaining withdrawal and how we can combine two methods at a time. Thank you.